We have over 500 or nearly 600 medical colleges, but they're hardly producing 100 students, 150 doctors a year. Whereas these medical colleges can easily produce 500 doctors a year. So we spend more than 500, 600 crore rupees and create an edifice called medical college, and that produces only 100 doctors, 150 doctors per year. There is a huge productivity gap. There are medical colleges with half the infrastructure in US producing 300 doctors per year. Now, are we going to say that we want to maintain a higher standard than American medical colleges? I wish we can, but we have to understand we don't have the money. So, existing medical colleges should be allowed to produce at least 300 to 500 doctors a year. Then, over a period of 10 years, we will be able to produce adequate number of doctors, because when India produces doctors, we can't look at Indian requirement. Right. Because there are over 30,000, 40,000 Indian doctors working in England, right? Huge number of doctors working in US. So Indian doctors are very comfortable in going to any part of the world and working and serving those population. But that's not other way around. Those doctors from those countries don't want to work in other countries. So when we are a healer for the world, we have to behave like healers. We have to produce, look at the global requirement. The crunch of health workers, what you are seeing is nothing compared to what you will see in the next 2 years. Because of the COVID, 10 to 15% of the actively serving nurses in US have taken premature retirement. And a significant number in England have taken premature retirement. People don't want to embrace healthcare industry. Now they have to fill up the gap. I'm sure you would have read in the paper recently the Premier and the Health Minister of Newfoundland in, I think in Canada, one of the provinces of Canada or one of the part of Canada. They are planning to come to India only for the purpose of interviewing nurses. Yeah. Yes. So it is going to be the norm. Today there are a lot of restrictions for an Indian nurse to work in those countries. Gradually these restrictions are getting lifted. Yes. So we will have a serious crisis. India is an amazing story of controlling costs or affordable healthcare. I left England in 1989 and I did the first heart surgery in Calcutta 32 years ago, and the patient paid 1.5 lakh rupees. Today we do the same operation for the same amount or even less. 32 years later, tell me what was 1.5 lakh rupees 32 years earlier is costing the same or less today? Nothing, only healthcare. That has happened primarily because of the passionate doctors, nurses, technicians and government policies to roll out healthcare in multiple locations, having large number of medical colleges trying to produce more doctors. But we are a big country. Whatever effort you make, there is so much to be done.